Good morning. Thank you for joining us for the Ministry of Health's virtual media conference on the COVID-19 response. Today we have Dr. Roshan Parasram, Chief Medical Officer, Dr. Osafo Fraser, County Medical Officer of Health for St. George East, and first time on the program this morning, Ms. Avalon Johnson Herrera, District Health Visitor based at the Arima Health Facility. I'm Candice Alcantara, Manager of Corporate Communication for the Ministry of Health, your moderator this morning. And of course, as usual, we go to the Chief Medical Officer, Dr. Parasram, for the clinical update.
Hi, good morning. Thank you, Candice. Good morning, Dr. Fraser, Nurse Herrera, members of the media, members of the viewing and listening public. So we will begin with the clinical update for January 15th, 2021. Total number of persons tested thus far are now 77,219, with new positive cases over the last 24 hours standing at 23. Total number of positive cases since March 12th are now 7,343. Total recovered patients, 6,913. Total active patients, 300, giving us a total number of patients in hospital at present, 30. The number of deaths are now 130, with the total number of persons that stepped down being 15, those at quarantine sites, 363, and those within home isolation, 232. To break down the hospital cases a little bit more, our ambulatory capacity at the hospital at this point stands at 12%, our ICU at 3%, and HDU at 1%. With regards to specific numbers, Couva Hospital and Multi-Training Facility, we have 15 persons. One of those are in ICU. At the Cora Hospital, there's 7 persons. At the St. Anne's Hospital, there's 1 individual. Scarborough Regional Hospital at the Fort, there's 7 persons. With regards to step down, there's 1 person at the Claxton Bay facility, 12 persons at the UWI Davey Hall, and in Tobago, there are 2 individuals. With regards to the quarantine sites, at the Cape Park Hotel we have 99, Chancellor Hotel we have 15, the Cascadia Hotel 23, Freedom Hall UWI 84, Cara Suite 6, Regent Star 72. This was as of this morning, so it's a little different from the 363. It's now 300 in total, but that was this morning's update. So, Candice, that's my clinical update for this morning.
Thank you very much, Dr. Parasram. And we go now to Dr. Fraser, who will remind us of the public health guidelines, especially as it relates to gatherings. We go to Dr. Fraser.
Okay, thank you, Ms. Alcantara. Good morning to the CMO and my nursing colleague, Ms. Pereira, and good morning to the listening and viewing public. I do want to take some time this morning just to talk through some of the public health guidelines that we are all very familiar with, but I think it'll be good to do a reminder this morning. All of our public health measures are based on our knowledge and understanding of how the virus works. We know that the virus is spread in most parts through droplet infection, and we also know that you can get it from touching infected surfaces. So if you cough or you sneeze, you can spread the virus if you have it. If you are in an environment where you are even talking and laughing and singing, has been shown to be effective in moving the virus from an infected person to someone who's not infected. We know that in close spaces, the virus would do much better in passing from one person to the other. So open air is better. So those things help us to design public health measures that work well for stopping the virus from spreading from one person to the next. So some of what we have already as public health measures that we're very familiar with. Wear a mask in public. That's one we hear about all the time. That's one we know all the time. I do want to say, though, that wearing a mask only works if you wear your mask properly. So covering your nose and your mouth. And mask regulation also talk about covering the chin. So if you are wearing a mask and you're not covering your mouth and you're not covering your nose, well, then you are effectively not wearing your mask properly. And the virus will have an opportunity to pass from one person to the other. we know also that while we talk about wearing your mask in private, the virus does not respect those spaces and those distinctions. So if you have invited someone into your house or in a gathering in a private space, it is also recommended that you keep your mask on so that you can prevent the virus from going from one person to the next. If you are in your own home and someone comes into your home, not because you are home and you are comfortable, you will leave your mask off. It is also recommended that you keep your mask on, even within the context of your own home setting where you have people coming into your space. If you are meeting at home and you're having people over, your family members have come across to visit, recommendation is open air is always better. So using your patio, those spaces are much better for helping to make sure that the virus does not spread from one person to the other. So wearing your mask in public, we stress public, but I'm also saying today, because you understand how the virus passes and it doesn't respect those spaces, also use your mask within the context of your private environment if you're having people over. We talk about hand sanitizing and washing your hands frequently. And again, washing your hands is the same as wearing a mask. If you're not doing it well, you're not doing it effectively, and you are still leaving virus back. In fact, washing your hands takes less than a minute, and it takes 20 to 30 seconds to wash your hands properly. And just by way of reminder, washing your hands means washing everywhere, right? Front, back, in between, get the tips as well. If you do that consistently, the more we do it, the more we practice it, the easier it is. If you don't do it effectively, you're effectively not doing a good job of keeping the virus off of your hands. Coughing or sneezing into the crook of your elbow, that should not be so much of a big issue now since we're all mask wearing, but it is always something to bear in mind if you're in an environment where you do not have a mask on and you have to cough. Maintain your social distance, and we say maintain social distance and we advise 6 feet. But obviously, the more distance you have between you and someone is the lower your risk of passing infection or you becoming infected by someone who may be carrying the virus. Avoid large gatherings as much as is possible, because like I just said, we know that the virus loves close quarters, lots of people. In those environments, the virus will do very, very well. So if you are, as much as is possible, avoid large gatherings in places where people have to be closely connecting with each other and close to each other. That is something that we will definitely recommend. Like I said before, if you have to be in a space with a number of people, open air is always better. If you can't do open air, you have to make sure that you are maintaining your 6 feet distance, because that helps to decrease the spread. One of the things that we say to people a lot: if you are ill and you have any symptoms, don't go to a gathering or a place with public space. Stay in your home, isolate in your home. We also advise, if you are feeling sick and you know you have symptoms that are consistent with the coronavirus, get tested. Make yourself present to the health facility in your area closest to you. Get tested. We have seen a number of people in whole families become infected because the first person got ill, thought I just had normal flu, did nothing about it, stayed at home, did not quarantine, did not isolate, and then eventually the entire home of 5 or 6 people becoming infected. And eventually when you test one of those persons, you found out, oh, this person does have coronavirus, and then the entire family is already affected. So if you feel ill, yes, stay away from public spaces, but it's also good to get yourself tested so that we can be aware and you can know exactly what's happening and prevent the spread to your loved ones. And then the last thing I would say about the public health measures is to keep cleaning and sanitizing your surfaces. One of the things we know is that if the virus gets onto surfaces, it can stay on surfaces for a little while. And if you touch an infected surface, well, then you can also end up getting infection. So all the doorknobs, the counter surfaces, make sure you're cleaning and sanitizing all those on a regular basis. So just to recap, if you have to be in a space where there are lots of people, a number of people gathered, You want to make sure that you are observing the regulation for the number of people that can be in that space, but you're also doing all the things: social distancing, wearing your mask, and hand sanitizing. The truth of how these public health measures work is that they all work together in tandem. The more of them you have working and acting, the lower the risk of infection. If you keep your distance but you take off your mask, you increase the risk of infection. If two of you are in a room but only one person is wearing a mask, well, then you increase the risk of infection. So all of the measures working together, both everyone wearing a mask, everyone social distancing, everyone sanitizing, those measures all working together give us the greatest chance of making sure we do not spread infection. So those would be my key reminders this morning for just the public health measures and gatherings.
Thank you very much, Dr. Fraser, for reminding us, one, that we should follow all of the public health measures, and two, that we should follow the measures properly if they are to be effective. Thank you again. And I go now to Nurse Herrera, who will give some insight into the current processes that we use to get vaccines to you, members of the public.
Pleasant good morning to one and all. Dr. Parasram, Dr. Fraser. I must say it's quite an honor to be involved within this meeting, to be able to address you, the public, in terms of one of the public health measures that we have within the community in terms of immunization, and to talk about the process that involves in storage of vaccines within the community level, right? So I want to let you all know that we as community nurses have been in the process of administering vaccines for many years. Some persons more than others, right? But let me address whatever concerns or fears that you may have in terms of the storage of the vaccines. And if we go to the first slide, one of the measures that we have within the community is something called the cold chain. Next slide. So some of the three objectives that I'd like to address this morning is to describe the process involved in the cold chain. Two, to highlight the quality tools used within the cold chain. And three, to identify the process at the local and community level. Next slide. So what is the cold chain? The cold chain is a system used for keeping and distributing vaccines in a good condition. Right? Two is a series of storage and transportation links to keep vaccines in an acceptable range until it reaches the user. And let me just add to that point, along with the user to the individual. And three, it must be kept at the correct, vaccines must be stored at the correct temperature in order to maintain the viability of the vaccines. Next slide. So, the process that's involved at the primary healthcare level, once Ministry of Health obtains vaccines and the county offices now would order vaccines. Vaccines are stored at certain county offices, and they have refrigeration systems with the correct temperatures to store vaccines. Once vaccines reaches this level, at the health center level, based on your population and a community need, we will be able now to order vaccines from the county offices. And the primary healthcare managers within each county will be responsible for distribution. At the health center levels, we have refrigerators appropriately storing facilities to store vaccines. And these are monitored daily. Even within the immunization process, we have our tools that's needed to be able to deliver the vaccines to the clients. So we have our vaccine carriers. And then within the immunization process on a daily level, we have it being delivered to the individuals. Next slide. So some of the tools that we utilize within the system to be able to monitor the temperature of the vaccines are portable thermometers. We have thermometers within our vaccine fridges, and some of the vaccine fridges now, they come with the temperature on the outside, and we are able to monitor. there is refrigeration temperature charts that on a morning and on an evening, we have to chart. These charts will let us know whether or not there's a breach within our temperatures within the vaccine fridge. And also another tool, our immunization vaccine carriers, which are appropriately stored because we have our ice packs, and so that we have to fit within the carriers, and also our thermometers within the cooler during the immunization process. Next slide. So the staff. I am here dressed in my uniform to represent the nurses within the communities. I'm a district health visitor, but we also have district nurses within the community who are trained personnel within the various health centers. So we have been trained to maintain the cold chain. We have been trained to administer vaccines safely in terms of our practices and in terms of our techniques. Vaccine safety is important to us. There is also a process involved. Let's say by chance, if somebody they verbalize that they have a reaction to the vaccine, there's a process that we follow, a pathway, to be able to report these things to Ministry of Health. And then, most importantly, in terms of infection prevention and control, so we have our measures in place. We must be familiar, and we are familiar with the protocol. And now if you come back to me, there are three points that I would want to leave you, the community outside there with. One, there are systems in place in order to monitor vaccines and to monitor its safety. Two, the staff within the community, we have been trained to administer vaccines, right? As I said before, some have been administering vaccines more years than others, right? And three, to you, the community, to you, the individuals within the public, you can access your local health center wherever you are. You can talk to your district health visitor. You can talk to your district nurses outside there. We are here to alleviate the fears and the concerns that you may have, right? And I just want to thank you all again for listening, and do be part of that public health measure in terms of preventing disease, immunization. Thank you.
Yes, just an update on two matters before we go to the questions. So one, the PAHO director, Dr. Carissa Etienne, would have had an update on the COVAX facility. And what she would have said, I am quoting from the release, she said the COVAX mechanism will eventually have 15, possibly 15 different vaccines offered to member states, and the distribution will probably start at the end of the first quarter of 2021, which is in keeping with what we have been saying with regards to our timeline for receiving vaccines thereabout March or thereabouts into Trinidad and Tobago. Also in the PAHO report, she mentioned that 8 countries of the sub-region would have had the variants, and that are 2 variants. There's the UK variant, which is N501Y, and the South African variant, which is E484K, has been confirmed in 8 countries so far, in the Caribbean region, most recently in Jamaica. With regards to the Pfizer-BioNTech COVID-19 vaccine, there was an update from the SAGE group, which is the Strategic Advisory Group of Experts on Immunization at the World Health Organization. So they have issued their guidelines for the use of the Pfizer vaccine in the population as of the 8th of January. And what they have recommended so far, in a nutshell, we have to be cautious with persons with severe allergies to give those vaccines to those individuals. We have to, they are not recommending for use in the pregnant population at this time. They are not recommending use for persons under 16 years of age. And they have been found to be safe in cases of persons who do have non-communicable diseases, for example, diabetes and hypertension. And all other individuals will continue to be offered as per our phase 1 strategy, which are healthcare workers who don't fall within that group, or persons with non-communicable diseases. As it relates to the dosing regime, they have also indicated that they will stick with the manufacturer's dosing regime, which is 2 doses, the first one and the second one, 21 to 28 days apart from the first dose. So basically, and again, they have reiterated the point in their letter dated 8th of January that vaccines alone will not end COVID-19, and hence the reason Dr. Fraser would have gone through all the public health measures that we need to continue, although we are getting vaccines into the country. And so that's my brief update.
Thank you very much, CMO, and thank you as well to Nurse Herrera. It's very important that we hear from our nurses in the community. That's a lot of the times a first touch point with the public health sector. So thank you very much for that very strong presentation. And we go now to the question and answer segment. Members of the media, you know the drill. Indicate your name and the media house that you represent before posing 2 brief questions as a maximum number, and please pose both at the same time. Of course, we'll try to get as many questions in as possible. We go right now to CNC3.
Good morning. My name is Sweeney Gray from CNC3. I have 2 questions for the CMO. Will the Ministry of Health be doing any investigations into the death of the patients at Port Spain General who appear to have contracted the virus while at the hospital? Or is the ministry confident that the meeting held last Tuesday with the bosses of the hospital would have provided sufficient information, and can we get it if not that? And also, there seems to be a disruption at the Freedom Hall Quarantine Center this morning. Some of the 84 persons housed there are saying that they have a range of issues, including not being fed breakfast on time, which is a problem because some of them are mature persons with medical issues that require that they take their medication with meals. They're saying that breakfast came today at 10:48. The schedule or the agreed time for breakfast is 8 in the morning. Lunch is supposed to be at 12 and dinner at 6:30 p.m. They are saying that they got dinner last night at 9, lunch yesterday at 2, and breakfast at 10. So if you can just get an update on the situation at Freedom Hall. Thank you so much.
Yeah, so in terms of your first question, yeah, so what you saw in terms of our press release was a high-level meeting involving the Honorable Minister and the TTRNA. We would have had constant communication with Port of Spain General from my office, as well as from the epidemiology unit throughout the incidences that would have occurred with patients being infected in the Costard building. So working with the infection prevention control as a routine, making sure the guidelines are adhered to with the medical microbiologists. So what you saw by way of the meeting was a high-level meeting with the operational parts and the relationship with the ministry on any RHA that would have had that sort of outbreak occurring would be constant, and we get constant updates from the Chief of Staff as well on the progress of the outbreak, as well as a day-to-day summary to let us know basically how the other patients are being treated, whether they are being swabbed, those sorts of things, to ensure that we minimize the impact of the outbreak as it progresses. So there's constant liaison between the Ministry and Northwest Regional Health Authority in this regard, and we will continue to keep you all abreast as it progresses. Candice?
Thank you. And the second question?
Okay, thank you for your question. My office gives overall coordination to the Freedom Hall quarantine facility. And the concern that was raised is coming to light now. We're currently investigating to see exactly what is the situation. And as soon as I know more, I'll be able to say. But just to say that the Freedom Hall has been operating as a quarantine facility for quite some time, has a very good track record of providing very good care. And this is not our say-so, it's the patient's say-so. So there may be something that's going on, particularly this morning. So we will be investigating to try and find out exactly what's happening.
Thank you very much, Dr. Fraser. And we go to AZP News, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question is for the CMO. CMO, there have been reports of a number of deaths of people who took the vaccine in Norway. I want to know what measures the ministry would take to ensure the safety of the people who would take it here. The first question. And my second question is for Dr. Fraser. Dr. Fraser, we are in the season of Carnival, and there's what we call the the virtual carnival fests. Do you have any guidelines for people who take part in these, especially where the event is hosted, in terms of what to do in terms of the COVID protocols? Thank you.
Yeah, so with regards to the cases in Norway, there is a claim that 23 persons would have been exhibiting adverse reactions to the vaccine in Norway in particular. It would seem that it is in an elderly cohort of people within a geriatric home setting. The investigations are ongoing at this point in time to elucidate exactly what the cause of the adverse reactions are. But in terms of the safeguard for the people of Trinidad, one, we have the benefit of time in the sense that we are able to see the use of this vaccine being rolled out across the world. In terms of the number of people that have been vaccinated, we're talking about millions at this point in time, and it's going up by the day. So we look at the adverse reactions that are occurring as one of the measures, and of course looking at what types of adverse reactions are occurring, and then eventually we will look at our strategy for rollout based on our both on two things, based on the regulatory approach. So any vaccine that is utilized will be regulated by in this case, it is already given emergency use authorization by WHO. I took the time to go through the SAGE group's findings for Pfizer in particular, because it does recommend that you don't use it for persons with allergies. In that particular cohort in Norway, they noted 13 of that particular group would have had some sort of hypersensitivity allergy type finding in the early days. So it requires the physicians, when we train the physicians to administer any vaccine, that they ask probing questions about the history of allergies, and that goes for existing vaccines as well. So it goes, the way we protect the population, of course, is by training our physicians, our nurses, to know the side effect profile of any vaccine that is given. There's the regulatory arm, which starts at WHO, and I assume coming out of all the events across the world that we will have the SAGE group updating their findings as of beyond 8th of January, periodically, looking at what is happening as the use continues and the rollout continues in various countries. So we will look at the findings of the SAGE group. As you know, we have a national TAG group, which again is supposed to meet next week to review all the findings as well, and we will look at all the incidents that occur across the world and building into our strategy. And just to remind the population, in our phase 1, the target is healthcare workers and frontline workers, persons above 60, and those with NCDs. At this point, we don't have immunocompromised persons as our group to be vaccinated in Trinidad and Tobago with this particular vaccine, especially because of the concerns that have been raised by the SAGE group and other persons around the world as it relates to hypersensitivity. So I hope that answers your question, Prior.
Just to answer the second question, these events, I understand, are being hosted in people's private spaces. And I would reiterate what I said at the beginning of my presentation, which is the public health measures and protocols do not break down when you go into a private environment. Like I said, the virus does not respect those distinctions at all. So I would say all those measures still apply. Mask wearing as a mandatory, making sure you keep your 6 feet distance, making sure there's hand sanitizing and hand washing facilities available, and making sure that the space that everything is being done in is one that can facilitate your social distancing. Those would be the recommendations for anything you have within your private space. And those will be my recommendations for any kind of event or gathering taking place in a private environment. Those recommendations especially are required to be held up and not broken at all in those environments.
Thank you very much. And we go to TTT, please.
Yes, hi, good morning. Sunil Lala from TTT News. CMO, I know you would have given on Monday, I believe it is, an update on the antigen tests with regards to how quickly it would be introduced into the system. Could we get an update on that? And what is the rollout strategy as it pertains to that? I know you said before, I think it was last year, it would be used as a screening tool. Is that still the case? How would it be used in the population? And secondly, for me, there is a news story on Sky News this morning that says ice cream has tested positive for coronavirus in China. How concerned are we knowing that it could be transmitted to food? how concerned are we that these proper protocols are being adhered to in the workplace in terms of these establishments, these food establishments down here, based on what we've heard this morning?
Okay, so just by way of a quick update with regards to the antigen, last time on Monday I would have said that within about 2 weeks we would have an idea of the time frame for rollout. So that still holds. However, I would have had a meeting with the lab team on Wednesday morning and asked them just that. So they have begun the phase of analyzing the data. So they have done quite a significant amount of samples for the validation process. They are analyzing the data now, and we are hoping that within the period of next week they can present some of the early findings, or if not most of the findings, to the ministry. Therefore, we will know what sort of validation results we get. So basically what we are testing to see is if a patient that is positive turns out positive by that test, if one that is negative by PCR turns out negative by that particular test. So it gives us an idea of the true positives and true negatives in the population. So basically it validates the test, and it validates what the manufacturer has said in a real world circumstance. So what we plan to use it for, it really depends on what we find in terms of validation. If it is, as the manufacturer has said, very good with picking up persons with symptoms, upwards of 93% is what they have said, then we can easily use it in a clinical setting, for example, an accident and emergency, which is where we plan to use it most of the time, in a district health facility or hospital, and not more so as a screening tool, but actually as a diagnostic tool to give you what we call a probable case of COVID-19. So you have all these signs and symptoms suggestive. You do one of these swabs, is 93% sure that it will be positive. There will be some random testing on the back end with the PCR to confirm. However, if all the signs and symptoms are there, especially on a backbone of community testing, community spread, we expect that it will be positive for positive. We are also testing to see, as I said, if you have negatives coming back as true negatives. And if that is the case, we could expand the use a little bit more. For example, pre-surgical cases, that means cases without any symptoms. If you're going for dialysis, for example, we can possibly use it in that scenario. So we do have close to 200,000 test kits in the country that we can use. So once the validation is complete, we get the results back, we will know how best to allocate it to the various RHAs. With regards to the second question, ice cream having been tested positive, I didn't see the research myself. However, as Dr. Fraser said, the COVID-19 can go on surfaces. So it can go on fomites, it can go on other things. Anything that someone who is infected touches, it can go into that particular food or that particular item. Doesn't mean that it can be transmitted, and it doesn't mean that it is infective at that point. There hasn't been any study that has proven that it is being transmitted by a fecal-oral route, which is meaning in foods. So, and it is certainly, there have been research that suggests that it will be denatured and not be infective once you cook something. Therefore, beyond a certain temperature, it will not be a viable virus anymore. So we will keep an eye on that particular finding that you brought to light. And then, of course, as the research comes out, we will look at it to see if there's a change in the public health measures that we need to put in place. However, just to give you the assurance, our food program through the Public Health Inspectorate has always been in place. And again, it goes back to basic principles of preparing food properly, serving it properly, hand washing, sanitizing of surfaces, continuing the public health measures to ensure we have a decreased risk of infection.
Thank you very much. And we go now to Express newspaper, please.
Hi, good morning. Camille Hunt, Express. I'm just following up on the Norway issue. Dr. Parasram, what is the advice for the elderly population here who might be fearful of getting the vaccine after seeing these reports? And I know you said the vaccine is not authorized for people under the age of 16, but is there a certain age limit where a person over a certain age should not get the vaccine?
As of now, there's no upper age limit for persons not receiving the vaccine. It is too early for the Norway incident or any other incident that has not been fully investigated. There are too many confounding factors to make a determination as yet. I would say our normal, and WHO stands by their elderly population being one of the first to be vaccinated because of the risk of death, mortality, and morbidity in that particular age group. And we have seen in Trinidad over the months that the majority of people that have died from COVID-19 do belong to the elderly group. And it's always a matter of weighing the risk versus the benefit of taking any medicine or any vaccine. So even in over the last 2 weeks or so, we have noted a slow but steady increase in the number of very elderly persons presenting back to the facilities. Particularly, we have seen some in Arima General Hospital as well as Port of Spain General Hospital going quickly thereafter to the Cuba facility, and we have seen the demise in those individuals, and is a concern. So vaccination will provide significant support to that particular group of individuals, and I don't want to use this particular incident that has occurred in Norway without being fully investigated to make a determination as to if there will be an upper limit for vaccination.
Thank you very much, CMO. And we go to Newsday, please.
Hi, good morning. This is Donaldi Souza from Newsday. Two questions. We have a headline stating that Jamaica has turned to Cuba and China because of vaccine delays. Is this a concern for Trinidad and Tobago? Also, there is a possibility, I know, that Trinidad and Tobago could be hosting an ICC tour later in the year. Has the government considered maybe giving local tournaments a chance to play and maybe consider that as a test run for these events?
Right. So in terms of your first question, and just to reiterate what I have said early on by the statement from the PAHO director, Dr. Etienne, has indicated that so far it seems that through the COVAX facility, the vaccine will be available to member states in this particular region by the end of the first quarter, which is March or thereabouts. So that remains the status regardless of what is being said outside of that. Again, Trinidad is exploring bilateral talks with some companies beyond the COVAX facility to ensure that we have an option outside of that as well. With regards to the ICC, I am not aware of any of that at this point. I believe that should be under the Ministry of Sport, so we can liaise with them if and when that is necessary.
Thank you very much. And we have a follow-up question from CNC3 at this time.
Hi, good morning. Sorry. I wanted to find out, has any decision been made on the home of football and the tennis center in Tacarigua? Apparently, a meeting was held either Thursday or Friday to make a decision on those two quarantine facilities. My sports department is very interested.
In terms of the final decision, I'm not sure that a final decision has been made as yet. So there's a preliminary decision, but I'll wait for the final decision to be made before we make that public. All right.
Thank you very much. And I see we have a follow-up question from TTT.
Yes, hi, good morning again. Sanal Lala, TTT News. CMO, we've just gotten word that there's a group of 6 in Barbados with exemption, but they're still awaiting the 72-hour results. They were forced to apparently miss their first repatriation flight on the 6th because of late results, and they're on today's flight list, but still in Barbados, and Barbados apparently is running late with the results. Can we probably offer some assistance to them?
I'll give you the same answer I gave on Monday, which is basically the policy for entry into Trinidad and Tobago, which is 72 hours, having a PCR 72 hours or less before you come into the country. I have reached out to the CMO of Barbados to see if they can actually assist, but because of their numbers in Barbados keep going up, they're having difficulty actually doing the tests as they should be. I would have offered that, they do the swabs and we do the results here in Trinidad in one of our labs, but I haven't received any positive feedback in that regard. So I will keep communicating with my colleague, and hopefully we can lend some assistance.
Question from CNC3, please.
Hi, good morning. Again, 2 quick questions. I know that Barbados' Prime Minister Mia Mottley said that she was able to get the vaccine Could you give any insight on that? Like, what's the relationship between their vaccine process and ours? And two, I have a personal question for the CMO, just in terms of coping during this COVID pandemic, because we know a lot of people are under a lot of stress. What tips, how have you been finding it, and what tips can you offer to the general public who are really struggling with adhering to the COVID-19 protocols and the necessary restrictions of freedom of speech? Thank you.
Okay, so I believe I mean, from the little information that we have regarding the vaccine in Barbados, I believe it's just a very small number of doses, 5, if I'm not mistaken, that would have gone to Barbados. I can't say what source they would have gotten it from and what type of vaccine. I would have read the release that was sent out. So that's about all we know so far with regards to the vaccine in Barbados. With regards to coping strategies, again, personal and otherwise, everyone has different ways of coping, and we would have had Dr. Otello go into depth as to possible measures. Of course, exercise is a common thread. A lot of people like to use exercise to de-stress, listening to music, those kinds of things, finding time to yourself or time away. It varies. I mean, it's dependent on different individuals. But I think having the vaccine coming soon and being used in most parts of the world should be viewed as a very positive sign for all of us. Looking at this pandemic going forward, 2021 should be viewed much more positively than 2020 was, I think, because we actually have a number of vaccine candidates that have been successful and have been rolled out in different parts of the world. And it really is something that can see is sort of the light at the end of the tunnel and should give all of us a sense of hope. And if and when the vaccine comes to Trinidad, of course, making an appeal to everyone, especially the vulnerable groups in the first instance, to really take your vaccines, because the only way we can get over this is if we get to a state where everyone is safe by way of vaccination or previous infection. So generally, I don't know if Dr. Fraser wants to share his coping mechanisms to us.
I suppose one of the things that I find to be useful is just staying in contact with family and friends. I know now it's difficult to physically see people, but lots of us have had to learn how to do so online. And we're doing all kinds of things together. We're cooking together, we're exercising together, we're having games night together. So I just want to say that while the physical distance is something that we have to try and maintain, we have discovered ways to do it in the virtual space. And I will encourage people to do that as much as is possible. Even if you're not very familiar with the use of the technology, make a habit of calling and connecting with your friends and your family and just talking through in real ways some of the issues you're going through. I have found those things to be very helpful in dealing with the stress of all of the measures that are currently upon us.
Thank you very much. And I think it's probably fitting for us to go to Nurse Herrera. Nurse Herrera, what are your coping mechanisms during this time?
Well, in terms of coping mechanism, I have a good team at the Arima Health Facility. So in terms of staff, so we work together as a team to get things done. So that helps quite a lot. In terms of family members help me out in terms of having me laugh, play, etc. And also we must remember social distancing and practicing all the protocols involved to be able to go out there and function. Because we don't want, at the end of the day, for us to be able to come down with the disease so that we would not be able to function. So in terms of coping and spirituality as well, I must bring that in, because as nurses, we have to look at the whole round individual. So we play, that is a major role as well.
Thank you very much, Nurse Herrera. And this morning, our CMO commented on the music that I was playing in my car as I drove in. Soca music this morning, that's one of my coping mechanisms. And back to some serious business now. We go to TTT, please, for a follow-up question.
Yes, hi, morning again. Final question for the day, I promise. CMO, there's a popular laboratory along the East-West corridor. I wouldn't call the name, but I'm being told that they've gotten international accreditation to test for the COVID-19 serological test, which is the antibody test. Can you say whether this is being done, and did they have to get approval from the Ministry of Health to do this?
So as you know, the way the public health regulations are written, what they have to do is they have to report any test results to the ministry, which all the labs have continuously done. To the most part, I'd say they have reported both negative and positive results to my office. So once they report the test results to us, then they have fulfilled the public health regulation as it stands. By use of antibody tests, however, they have to, of course, be mindful of the use of antibody tests. There's limitations. They pick up usually later disease, so they'll pick it up somewhere between 10 and 30 days of disease. It doesn't usually pick up a disease that is actively in state. It can through an IgM, however, it is usually the PCR that you tend to use if a person has active symptoms. So it's just a cautious word, but again, once the reporting is done as per the public health regulation, then we are happy for testing to continue.
Thank you very much, CMO. And I don't think we have any more questions. I guess we were very comprehensive today. We want to thank everyone who participated. Our Chief Medical Officer, Dr. Parasram, Dr. Fraser, first time on the conference, Nurse Herrera, and I have a feeling that we will have Nurse Herrera back. Thank you very much for taking the time. Today we learned that we all have a part to play, even as we suffer from COVID fatigue and pandemic fatigue. We all have a part to play in ensuring that we cope, but we also follow the guidelines. We have to follow the guidelines within our homes and outside of our homes. What are these guidelines? If you have auntie passing by to drop something, stay in the yard, wear your mask, make it brief. Say, wave, auntie, thanks for coming, and go on. Keep your distance from others. Others includes your family members as well. We are, warm, loving people, and we have other ways that we can show love. We don't always have to touch and hug to show love. Stay home if you are ill. What a way to show love. Stay home so that you don't spread the disease to others. Wash your hands often with soap and water, or use an alcohol-based sanitizer. And Dr. Fraser reminded us today that washing hands means you must wash all your hands. Front, back, in between, the nails, and even, all of this area, 20 seconds minimum. If you're washing your hands like this and you think you're done, you haven't really done anything. Cough into a tissue or into the crook of your elbow. Avoid touching your face, and clean then sanitize surfaces. Of course, all of these measures help to reduce the spread of other diseases as well. So it's a real benefit. We also learned today that Trinidad and Tobago has a well-oiled machinery as it relates to the vaccination program. We have a very strong and robust vaccination program. You heard from Nurse Herrera, who's one of the representatives of the staff that we have working very hard to make sure that everyone has been vaccinated, all your children. We also know that CMO gave us an update from PAHO as it relates to the vaccines. And I want to go to CMO. I think CMO has an update for us. So we'll just go over to CMO to give us an update on one of the questions that came in today.
I got an update with regards to Freedom Hall, as Dr. Fraser would have been investigating. The meal delivery times were resolved by the Chief Operating Officer of the North Central Regional Health Authority, so that those persons should be receiving their meals on schedule. The nursing care, they have indicated that issue with regards to special needs is also being addressed by the North Central Regional Health Authority. So just to answer that question that came earlier.
Thank you very much, everyone. We've come to the end of the conference. Please remember, do all that you can, find your coping mechanisms, and of course, wear your mask, covering your nose, your mouth, and as the law says, it must reach your chin as well. Have a good day, everyone.